Hi, I'm Molly Resnick, and welcome to another edition of Labriyut to your health. 20 years ago, a person waiting for a kidney had a 50% chance of receiving one. But as medical technology has advanced and life expectancy has grown, that ratio has changed. Today, with over 100,000 individuals on the waiting list, a person waiting for a kidney faces just a 20% chance of receiving one. In fact, 90 people die in America each day waiting to receive an organ. The rate of donation has simply not kept up with the increasing demand. There is only one country in the world that has no waiting list: Iran. There, the government sponsors and controls a legal organ market. Instead of being placed on a hopelessly long waiting list, patients approach an organization called DATPA, Dialysis and Transplant Patients Association. DAPTA offers physical exams and compatibility tests for both patients and potential donors. Once a match is made, they oversee the medical and financial transactions. The United States and most countries around the world only permit donation for altruistic reasons. So should other countries consider adopting Iran's for-profit model? Perhaps there would be more donors if they were given money, in addition to gratitude. We've polled some individuals on the streets of New York.
Selling them, only the rich would be able to afford them.
I see the logic behind it, but the problem I have with it is people who are destitute or really need the money will feel compelled to give a kidney.
At first blush, it strikes me as something that might be possible, but I'd really have to think about it.
How much would you sell your kidney for? That's a good question. 10 million for sure, I would get rid of one kidney.
I think it's a very controversial question.
It's not, my body is not something that's a product I can buy and sell.
No, I don't think it's morally or ethically right.
Some people are worried about the safety of kidney donation, the risks of surgery, and then life with only one kidney. Dr. Edward Reichman is professor of emergency medicine, philosophy and history, and a renowned Jewish medical ethicist. Dr. Reichman, can you weigh in on the risks of donating a kidney? And what about the financial incentives?
When kidney donation began back in the 1960s, there was a significant mortality associated with donation. But now, some 50 years later, donation has become significantly better, and the risks to the donor are significantly improved. There are, however, still some limited risks. With respect to the issue of selling organs, obviously a very complex issue, while it is against American law at the present, there doesn't seem to be any innate reason why selling organs should be bad. All these issues need to be considered, and in fact may be considered a viable option in the future.
Now let's turn to Rabbi Yehuda Pink for the halachic perspective on this issue.
In light of the extremely low risks associated with live kidney donation, the consensus of the vast majority of halachic authorities is that it is permitted and perhaps even encouraged to donate a kidney to save a person's life. As the level of risk varies according to individual circumstances, every potential donor must be carefully screened to ensure that there are no factors that would be counterindicative to safe donation, and a competent rabbi with expertise in medical halacha should always be consulted prior to donation. The issue of payment for donating organs is more complex. In principle, there is no halachic impediment to paying the donor as part of a carefully regulated system that would ensure that there is no exploitation of financially disadvantaged people. However, it is self-understood that this is only an option in a country where the law of the land will allow this.
As the demand for kidneys continues to increase, there is growing support for a legal organ market. A 2007 Gallup poll revealed that more individuals would be inclined to donate if given incentives. And a poll of the American Society of Transplant Surgeons found that 80 to 85% of the doctors were also in favor of exploring the possibility of incentives. I'm Molly Resnick, and thank you for joining us for another edition of Labriyut to your health.